I do want to just add there are a couple of people who I did mention before I wanted to just thank who are here. One is Senator Lou Frederick, another champion for mental health. Also, staff from Mayor Ted Wheeler's office is here, along with staff from Representative Jeff Pepperidge's office, which is wonderful back there. And then also another thank you to Health Share of Oregon, who is well represented here today and has been a real partner in providing so much background and information and data that has been used to put this report together. So, we've spoken about a lot of things already. I was going to make some remarks about those, but I think Bevan has covered so much, and I really think it's most important to get to answer your questions. You know, if no one has any questions, then I can blather on a bit, but I would rather just answer your questions with one thing I do want to say, and that is this report, we didn't do this study for it to sit on a shelf. We have libraries full of reports and studies and all of this that do sit on shelves. Fortunately, Bevan and her group have gone through all those. They have been read, they have been accounted for, they are in this report. You know, we are trying not to reinvent wheels, but the idea of this is to provide an action plan. So it's the culmination of a process of engagement, and I do feel like this is great. We celebrate that we have this 6-month project that we have accomplished with a lot of input and help and heart and soul from the community. But we're on the launch pad now, and the real work is actually ahead of us. And that is to put some of this into action. And in that regard, we have some short-term goals and more long-term goals. I think of this in the sense of what I want to look back on in 10 years and say that we've accomplished, where I want to get to. And then look back and say, well, how far along have we gotten toward that? Hopefully the whole way, but I have no fear of aspiration. I think we need to aspire to a system that is somewhat transformative and that actually works for people. So we need to start to develop that shared vision among all of us at the county itself and with our partners, with individuals in the community, so that we know what we are striving for, and that is something that we all share. So we will bring people together to begin having that conversation, so we have the goal, and that we can then devise the plan to work there instead of just kind of saying, oh, we need to improve this one off, we need to improve that. We need a North Star, I guess I'll say. In the short term, I'll North Star, there you are. I will also be working with others to identify and advocate for some key shared state legislative priorities. So hopefully our legislators in the room are pricking up their ears for the 2019 session, because we're not in it alone. A lot of the work that we need to do is connected deeply to work at the state and even the federal levels. So we want to work together toward those shared legislative priorities. And then I also want to convene a group to explore potential options to address those workforce needs, which are so prominent and so important. And also work with county staff to discuss elevating the role of lived experience and leadership here at the county, as well as work on improvements in data integration so we can better coordinate what is going on in the county. So longer term, you know, put all this together, step by step. So from the start, the study's been grounded in the perspective of individuals experiencing the system, whether it's consumers or providers, families, friends, others, And that's absolutely essential to understanding the system as it exists today, but also marching toward the future. So we are going to continue that. And with a shared vision, we can begin to take those steps that are so necessary to get us to that North Star that I think we also desperately need and want. All right, with that, questions?
I think we have a first one already.
And we have a first one already?
We'll let them. I think it's for me. So this question is, when we gather the data, how do we engage with communities of color? So the way that we identified stakeholder interviewees was we really worked through different organizations to help us, in terms of identifying service user interviewees, we worked with different organizations to help us identify folks. Working with Commissioner Meyer's team, with Shannon Pullen, we reached out to a number of different organizations, NAMI Oregon, the Office of Consumer Engagement, NAMI Multnomah, many different organizations. They are listed in one of the appendices, and really tried to identify service users to speak with. We did get a lot of response from service users of color, which we were really glad for. So a good number of the 20 individuals did identify as service user of color and spoke from that perspective, which we were really grateful for. We also reached out to each of the culturally specific providers in the county and engaged with them around those different culturally specific issues. And then we used a snowball sampling technique in our process. So we asked, for all of the interviews, we asked interviewees if there was anybody else that it would be important for us to talk to. And we also reached communities of color in that way.
Okay. Can you hear me now?
Okay, can you hear me now? Bridge Crane would like to know where else a lived experience staff at the executive level has been employed, and what supports are designed to enhance success and or prevent any type of symptom flare-up or relapse, etc. Are there other places that this has been done? Yes.
Oh, okay. Yeah, so a lot of different states, large counties, and SAMHSA, the Southwest Mental Health Services Administration, have a director, director of consumer affairs, director of service user experience, etc. So there's actually a website, and I believe we linked to it in the report. If not, we can add it in the final version. A paper that was done a few years ago by the National Association of State Mental Health Program Directors on best practice for these positions. I believe there's also an association of lived experience directors out there. So there's certainly best practice. A lot of different counties do it. In terms of the symptom piece, in terms of supporting people if they start to have a rough time, for that we know there's a whole lot of best practice, and really what a lot of it boils down to is that people with lived experience may have a rough time at any point in their life and need a reasonable accommodation or support, but so do people who don't have a mental health diagnosis. The truth is that we all need mental health days and mental health support, so really foundationally, as with any good workforce, any good employer, people are supported to be well and be healthy, and there's also a wealth of information around reasonable accommodation and how to work with that. So those areas are well covered, and it's fairly well-worn territory. The director of Consumer Affairs at SAMHSA, federally Paolo Del Vecchio, actually recently was promoted to the director for the Center of Mental Health Services at SAMHSA. So this is a person who is in a lived experience leadership position who now runs the whole mental health agency at the federal level. So we have plenty of examples of best practice.
Okay, we have another question. Has Multnomah County looked into how Marion County's work in diverting justice? Meaning, have they looked at how Marion County, their model of DA, sheriff's, public defender office, and mental health?
Did I get your question anywhere near right? Kristen, in this camera?
Yeah, mostly.
Okay. So it sounds like you think that Marion County is doing a good job, and is there anything we can learn from that?
And I'm not a complete subject matter expert on this, and I'm perhaps sure if Reese knows has some additional information, but I personally am aware of Marion County and how the work that they've been doing. They actually are doing some fabulous work and do have some really innovative programs that they've been able to implement. I believe that our LIPSIC group, our local public safety coordinating council, is also aware of those programs, has investigated those, and we have some of our own kind of versions of that, but there is an awareness. I don't know to what extent, so I'll find out and look into that more. But they're a great program. Do know that.
Great, and we have another question about the peer leadership role. Essentially, how do you anticipate or expect or recommend that the peer leadership role encompass adult peers, youth peers, and family peers?
Great question. It probably can't, right? It's just one role, but it would be a start. And ideally, it would be a person who has linkages and connections to a lot of different groups and really thinks in a big picture, system level way about lived experience for all of these different groups, because we know that it's important. Again, it doesn't, we're better representing the lived experience perspective doesn't end with establishing a director level leadership position. It's really about creating more pathways for lived experience to be more fully represented across all different population groups. One person can't possibly do that alone, but hopefully they can provide a bridge.
Any other questions?
Yeah, I got a question. I don't like to write on those cards. So I'll just ask it to you directly. What do you actually do for somebody laying on the sidewalk or somebody in the tent to provide the services to them or to get them to come into the services? What's being offered out there for those people currently who may not go to Multnomah County, who may not even try to get those services? What do you actually do on the outreach for those individuals?
So there are a lot of different models and a lot of different ways, and the truth is every individual out there is different and probably needs something different. So ideally, the first thing to do is find out what it is that they do need, what it is that they do want. So that's like a general global piece, right? But yeah, I mean, there are outreach services, there are peer services, people who have themselves been in that position on the street who can come out and share their story and engage in that way. There are ways to think differently about mental health services, for people who just do not and will not want to engage with the system. What are the other ways that they can be supported? But the other thing to mention here is that it's important to remember that people who are living on the street and in really desperate situations, at one point were not in that situation, and there must have been many, many, many opportunities, missed opportunities along the way to support them and to give them what they need. So it's always important not to lose that bigger picture and focus only on what's right in front of you, and to really think more globally on a population level.
If I may just respond real fast, isn't that what trauma-informed care is? But how do you incentivize somebody laying on a sidewalk or somebody in a tent to go to those services? Would you offer them like a $20 card to come in for a trial offer to understand what you're doing? Because I don't think they're getting any incentives to do it. That's my point. And your response, it doesn't sound to me like there's a lot of outreach to those people. And I can speak on behalf of many of those people to say there is no outreach to those people.
Yeah, and I think that is what we found, and that's what we heard from a lot. Yeah, that's what we found. So yeah, we agree. I mean, what I will say though is that there is no outreach, because it is there. And to say that there is no outreach discounts the very amazing work that a lot of the homeless street outreach team is already
Don't
doing.
give yourself accolades on that. because
Okay,
there's
but anyway,
not very much outreach.
just
Anyway, I'm
so
done.
we're in
I'm
agreement.
done with your
Thank you.
comment. Thank you for your time.
So I think we've got a couple more over here, but did anyone need cards? Because some people, yes, okay.
Kevin?
Is it proper to ask a question from the audience, or should I write it on the card? Because it might be client involved. I just want to say a kudos to you from HSRI. I want to say a kudos to you and the leadership of HSRI, your sensitivity, your thoughtfulness, your probing questions, I thought was just terrific. Also want to give a shout out to Commissioner Myron's office, Shannon, and Katie, and all the rest of all those folks. Just amazing, their sensitivity around this sort of stuff. And then my question, and then also to, of course, Dr. Myron and her leadership. When she was running, she said she was going to do this. My question is, as a 30-year person in services and an advocate, number 2, I think, is fantastic. I think it blows the doors off of some of the stuff we're talking about. My question is, and I raised this an awful lot in the state of Washington and the state of Oregon, that when you talk about an individual who has lived experience, if I go to Stanford and get a PhD and I have a little depressive episode and I end up taking Celexa, it's not the same as Kevin Fitz being homeless, having schizophrenia, being in state institutions, being diagnosed severe and persistent mentally ill. The challenge that we find, sometimes the socioeconomic strata, if you're James Taylor, you have suicidal depression, you go to McLean Hospital, nobody knows about it, and it sews back up. But if you live in the public sector and you're a public mental health client, it's a whole different road. And so what I applaud, number 2, I applaud an awful lot of things about this report, but particularly number 2. But if you are thinking about turning that into policy and actually moving forward, please, 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 I beg and plead that you consider folks that have come from places like me and others who have received public mental health services, been in psychiatric institutions, been homeless, been incarcerated, and had that journey, because I think that's key and informative to a better mental health system in the future. That's my main point. I hope that's clear.
Before you jump into that, I just want to say thank you to Kevin, but this really echoes the card that has just been handed to me before he started talking, and he said, this card says, for the peer leadership role, would it be based more on lived experience, less on academia? People can navigate systems for 20 years without a degree. So this feels like it feeds into your comments. I just wanted to get in there before you started talking.
Yeah.
I think we're coming at it from different sort of perspectives, but want to say the same thing. And the short answer to your question, Kevin, is yes. At the county, as we're having these conversations, first of all, they will be guided by you all. And as we're, that is, what you're talking about is so absolutely important and crucial, and recognizing that that difference in those gradations. It becomes complicated. What point do you draw that line? But those are the conversations we need to have, and I think we're going to end up at hopefully the right place.
Yeah, Kevin, thank you for saying that. When I described lived experience in my presentation, I was very careful to say lived experience of the publicly funded mental health system. I would be willing to bet that most people in the room have lived experience of some kind of mental health issue. Otherwise, we wouldn't care in the way that we do. Okay, so yes, and that lived experience is important, but we're talking about lived experience of the system. And that's why the specific role dedicated to that perspective, and to bring that perspective, is so important. Yes.
Bethany, can I just jump in? And there's one more question that's kind of in this vein, and then I have 2 other new topics, so I just want to kind of be able to wrap this up. So someone was asking about these directors with lived experience. Where do you see them in our government, and at what level? And you see them at places like Cascadia, and only one for the county, which I don't.
Yeah, like I said, it's a start. Okay, so it's a start. One other thing just about what you said, Kevin, another thing that I think I picked up from these comments comments was that a lot of people who've been through the publicly funded system didn't have time or opportunities to get a master's degree. So in recruiting for the position, it's probably not the best practice to require a master's degree. So life experience is the credential, right? Along with skills and ability. It's a hard position to fill. I don't envy you with that, but I also recognize that there are some really talented folks, so I'm sure that there would be plenty of interest. Anyway.
Thank you very much. I can't stress that your thoughtfulness and sensitivity, your previous work, I'm looking at peers and other systems, it was just very perfect and just great. So I just want to give you a round of applause.
Yeah, in terms of other states and counties, you can Google Office of Consumer Affairs, it'll come out. New York has one, LA County has one, federal government, lots of states have them. It's pretty common.
Okay, so a new topic, how can mental health and addictions be provided to seniors on Medicare Advantage plans and help to pay for such services?
That's a tough question. I can't adequately answer it in depth, but there's been a lot of work on this issue. One of the challenges at Medicare is federally administered, right? So it was beyond the scope of the study for that reason, but that's not to say that we don't recognize that people on Medicare have major access issues, and it is something to think about. And one thing to note is that the county does step in for people on Medicare who aren't able to access their services, and it's probably pretty important to look at whether and how that happens, and if there's enough happening there.
Okay, and then I just want to point out that it's getting close to the end. I'll probably be able to take one or maybe two more questions. So if you have something burning, please get it to me. What is the plan for transparency while this unfolds? How will our community know the recommendations are being realized?
I believe in full transparency of the process. So, we're sort of still, we're at the very beginning point. We're at, like I said earlier, the launch pad. But this is going to be, the whole thing is going to be an open process. If you have ideas how best to communicate information, to engage the most people possible, we would love to hear that. This is that snowball thing, sort of putting that out there for you to give me feedback and my office feedback so that we can do that work effectively and have as much input as possible. We do have a great cohort now of people, including yourselves, who are involved in this system, in this process, and that would be the start. We need to figure out the best way to engage, but even figuring that process out has to be transparent and involve everyone that we can in figuring it out. So I don't have the answer about how we're going to do it, but the process itself will be open and communicated to the extent that we are able.
All right, and then there's a question about frontline workers and clinicians. How can we support them? How can we support these frontline workers and clinicians to be supported to ensure that quality client care is being delivered?
That is one of the key questions. It is one of those themes, as Bevan has said, that pervaded this entire report that came out again and again, as no matter who we talk to, at what level, in what capacity, and what their experience. And this is going to be a conversation like I had. I want to convene a group at the county level, but this isn't something that we can answer at the county level necessarily. We are going to need to engage our state legislature, our state partners, work at the regional level, and even at the federal level, although I have very low hopes for anything federal right now, but hope for the future. But to at least work at the state level, because we will never be able to address this system and these systems changes unless we get to the crux of that workforce issue. It's essential, and people need to be absolutely valued, paid for that value, not overworked, and we need to figure that out, so.
So there was an additional question about the peer leadership role, and I don't know if maybe this person feels like their question has been answered, but just to make sure we're buttoning this up. Someone was curious if that leadership role would sit in the Commissioner Myron's office or at MHASD.
Again, we have to, I literally just got this report, it's still a draft report. We want feedback with correction, if you see anything that's erroneous in it, we do want that feedback with corrections. But I am dedicated to pursuing this and developing that type of position. It probably won't be in my office because it needs to be broader than that. So I would envision it probably at MHASD, I don't know. But it will be an elevated position, the way I view it, at the county. We will flesh that out transparently and with input, and work on at least bringing that best practice to Multnomah County.
And then this question was about one of your comments, Commissioner Myron. Is it truly your belief that we do not need to reinvent the wheel with regard to mental health?
Well, if the wheel is what we have now, then I think we need to reinvent the wheel. That's my personal opinion. No one would have designed the system that we have now if they started from scratch. What we have now is a piecemeal approach to address crisis upon crisis upon crisis in different disparate ways, which don't integrate, which don't necessarily make sense, which are not person-centered, and the funding stream, the way the whole system works, at least to me, does not make sense. So what I envision is actually mental health care systems transformation. We'll see to what extent, and that is my goal. To what extent I can achieve that, we'll see, but I am dedicated to developing a vision and working diligently toward that vision in every way that I can.
So we'll go with one last question, and that will give you guys time to wrap up. What is the time frame for developing this mission? The end of the year? It is a great idea and needed.
Sorry, can you say it again?
Yes.
Somebody realized that.
We got a lot of snacks back here. So this person's question was, what is the time frame for developing this work? Is it the end of the year? It's a great idea. This person's endorsing these ideas and that they're desperately needed.
The time frame for the mission,
Yeah.
for getting the mission, the first piece done is what I'm asking about.
To the launch. The time frame for that, I feel, is starting definitely by the end of the year. That's my goal, to get a team together in whatever capacity that is, and getting off the ground for the next, like I said, the next steps, which are the really hard work of developing a vision so that we can ultimately get there.
Well, I think that's going to wrap up our question and answer period.
We have some remarks. Final. Oh, I have final remarks.
I have final remarks. Okay. Wrap-up notes. If you did not sign up for the newsletter when you arrived, my newsletter, where I do give updates about this process, get online access to the report, which you can also just get online at the county website, but where I give information about what I'm doing at the county, talk about transparency, it's on in that newsletter. Please sign up. It's a good way to stay updated on my work. We have a lot of extra food. If anyone has a good way to put it to use, please let us know, or just go back for seconds or thirds or fourths before you leave. And please note the report is posted online now, and we will have a form open through July 18th. If you see errors, so this isn't a time we can't take further just input about systems at this point. That will be an ongoing process, but not for the report itself. But if you see errors, we need to know, and there's a form you can submit that information. So, thank you again. Go eat.